EKGs don't always capture an arrhythmia because that's just a snapshot in time. So with atrial fibrillation, paroxysmal atrial fibrillation versus persistent. So in the beginning stages, atrial fibrillation may come and go. So you can have bouts of it that can last minutes to hours and then go away. If you're experiencing symptoms that are intermittent and we do an EKG in the office, it may show us normal sinus rhythm because you're not having the arrhythmia at that moment. But that doesn't mean that the symptoms that you're having aren't due to an arrhythmia. And so in that case, we need a way to monitor you longer, which we have an event monitor, almost a sticker that goes on your chest, like wearing telemetry in the hospital, and you can walk around with that for a couple of weeks, and that's able to capture the symptoms and allow us to see the heart rhythm during those symptoms to determine what's going on. So most common symptoms of atrial fibrillation, people actually experience atrial fibrillation in different ways. Some people have no symptoms at all. Commonly, people may feel palpitations or sensation of their own heart beating oddly or feeling funny. Some people that think they're not having symptoms may notice over time that they're actually feeling more tired than normal, that they have less energy, they're not able to do the activities that they used to do. And after restoration of normal rhythm, they realize what a difference it's actually made. It's almost like when they've been in atrial fibrillation for a while, they just get used to that feeling. They forget the energy level used to be better. So one common question I get from patients is how to prevent atrial fibrillation from happening, and why it's not always possible. If you have atrial fibrillation, you have atrial fibrillation. It tends to come and go when it wants to until we do something about it. But things we can help, possible triggers would be high blood pressure. So controlling high blood pressure is one of the best ways to prevent recurrence. Untreated sleep apnea is also a common cause. So if your partner says that you snore a lot at night, wake yourself up at night, tired during the day, maybe something we want to look into. And weight loss is another good thing to help prevent recurrence. Even just a few pounds of weight loss can help. Atrial fibrillation is one of the most common arrhythmias worldwide. Two ways to treat atrial fibrillation would either be with medication or with the ablation procedure. The ablation procedures are done intravascular, so there's no cutting. It's done through IV sticks in the groin and also in the neck. We go up with our catheters through the veins into the heart and think of it like focal freezing or burning to try to make the arrhythmia stop and make you maintain normal rhythm. So one thing I love on follow-ups with patients, particularly patients that had atrial fibrillation for some time and didn't realize the extent that it was impacting their life, is that their follow-up appointments, they have so much energy and they feel back to normal. And they're able to do things that they weren't able to do anymore. They're back living their life and exercising.